Hi, I'm Cecily, and I chose to research the effectiveness of telemedicine. I chose this topic because telemedicine is extremely prominent right now because of the coronavirus pandemic, and to stay safe, many don't want to and cannot take the trip to the doctor's office. So you may wonder what exactly telemedicine is. By definition, telemedicine is the practice of caring for patients remotely when provider and patient are not physically present with one another, whether this be through a Skype video call or you can text your provider through your health portal. To provide some background and history, the first use of telemedicine as we see it today, like the video call, was in the late 1950s when the University of Nebraska used the first ever real-time consultation video to provide a neurological examination. Ever since, technology everywhere has advanced, and we see it advance today, and that includes the telemedicine advancement. While researching the effectiveness, I noticed and focused on the several leading factors, including patient perspective, as well as provider perspective, service, and cost. To start off, we can look at patient perspective. I used the Bucks Library database, and I looked into the academic journal titled How Does It Work? Factors Involved in Telemedicine Home Interventions, Effectiveness, a review of reviews. So basically this was a bunch of analyzed data from other research that was compiled into one big summary. So here they looked at diabetes patients, and they found with telemedicine interventions for the generally older diabetes patients, they felt a sense of discomfort and a lack of confidence with the technology and had difficulties integrating the new technology into their daily lives. So this proves how telemedicine is not as effective for older adults because they're not dealing with technology like the younger generations, and they weren't growing up with it. And then when we dive into the provider's perspective on telemedicine, we see more positives. So most practitioners have been using computers their whole career as technology advanced, and everything is charted online on a patient. They can look up their history. So they've gotten used to medical technology. And a major point that I noticed in one of the reviews says that providers' computer literacy and experience with technology influence their acceptance of telemedicine. So they've seen that telemedicine has worked for so long, so they know it's effective. And then I looked at an article from the Effective Healthcare Program titled Telehealth for Acute and Chronic Care Consultations. And this explained this increased service part of telemedicine. So both the provider and patient will benefit from reducing travel times and costs and being able to stay in their own homes for the health meeting. And service through telemedicine would also increase because there would be no wait time for patients, since they can just get on the call whenever their time is scheduled, and there's more access to physicians because you can schedule your video call whenever, or you can text through the health portal. And then cost is another factor that plays into the effectiveness of telemedicine. So I found a PDF titled Telehealth Helping Hospitals Deliver Cost-Effective Care, which was published by the American Hospital Association. And it explains how the Congressional Budget Office has long thought that the use of telemedicine would cause more spending than usual care in a doctor's office setting. However, a quote from the American Hospital Association explains that the Congressional Budget Office predicted telemedicine would cost Medicare $150 million in the first 5 years, but in practice the program had only spent $57 million over 14 years. So this obviously shows how cost-effective telemedicine is, as the real cost is only 1/3 of what was projected, and also significantly lower than usual care. To add on to the cost-effective nature of telemedicine, many hospital-at-home programs have been put into place that focus on more elderly patients that are either immunocompromised or they shouldn't be in a hospital setting because that puts them at risk. Specifically, Johns Hopkins University put together a hospital-at-home program that showed the cost of it was actually 32% less than that of traditional care in a hospital setting, and the incidence of other complications occurring was significantly lower as well. It was 9% rather than 24% in a hospital setting. So this shows that telemedicine not only costs less, but proves to be safer for the patients as well. So to summarize everything, older patients were generally less accepting of telemedicine than younger people because they haven't been immersed in technology as much, so they're not as understanding of it. And then providers view telemedicine as an important part of the healthcare field, and they know it's effective because it's worked for so long. And telemedicine proves for better service because there's no traveling or waiting, and you have all-time access to your physicians, and it's very cost-effective, as I explained before. Although telemedicine may not work for all people or be beneficial in all ways, we are lucky to have the resources and technology to use it during hard times like right now.